This is going to be a great session. I want to welcome everyone. Thank you for joining us. This webcast presented by Audivita Gives and, of course, in collaboration with the Support Site Foundation. I'm David Wolf. I'm the founder of Audivita Studios and Audivita Gives. So we're a podcast and audiobook production company. And for many years, we've worked with Dawn and the Support Site Foundation. But we created Audivita Gives to create an impact on the world, people in the world. And our mission is providing valuable resources and tools to empower those affected by many diseases of today. Of course, our focus is on macular degeneration, AMD. Many of you with us already acknowledge the Support Site Foundation as a reliable, trusted resource for AMD patients and caregivers. AMD is all they do. This is a nonstop thing, right, Dawn? This is there's no off button. It's 24/7, 365. You are thinking about this and implementing new things constantly over at Support Site Foundation. And so we're looking forward to serving you, our audience, with the fabulous guest expert, who you now know who it is, but I'll reveal her officially in a few moments. A little bit of housekeeping for today. We're going to run about 45 minutes. During the session, we're going to have poll questions that will pop up on your screen. Yay. So you know, and for you to actually interact with and answer. Please, we want you to engage with these questions so you can get the most out of our time together that we're spending. And take your time too. Don't rush through these. Really think through them. These are personal questions about you and your experiences with AMD and your doctor and so forth. So we want you to know also that we have some questions that happen when they happen. That is, you'll hear this sound. I'll do it again. I know, right? I'll do it again.
Spoon. I love it.
It's a nice gong-like sound. And that means we have a new poll question coming your way, which we want you to do everything I just mentioned. Take your time.
Little audio for the video, right?
Yes, exactly. Right. So I'll give that sound effect as the signal, and you'll see the question pop up on your screen. You can click on the most appropriate answer for you. I also want to give a special thanks, that is, to Sean Hedinger, who is driving all the technology for us today and helping us, keep things glued together.
You betcha.
Okay, so taking a breath here. Today's topic, what to ask my retina doctor about AMD, is a mutual, ubiquitous, common to humanity. Millions of AMD patients deal with this and deal with the questions. What should they ask? Care partners and loved ones who are involved in your doctor's appointments may be asking as well. How do I handle and orchestrate these appointments so that so I get the most out of them from my doctor? So the framework for today, Dawn and I, and really Dawn is the author of this, but we've created, it's all about empathy and understanding, because living with AMD is a 24/7, 365 affair. We know this.
Doesn't go away.
It doesn't go away. So we're coming in with a frame of empathy and really just trying to help you understand more about how to handle some of these key issues and the focus points that we'll go over in a little while here. Eye appointments with your retina doctor have the most significant impact on your overall well-being. They are critical to your vision loss journey, and it is a journey, and disease and care management. So eye appointments, we're going to put a lot of emphasis on that today. And the other thing we want to talk about is the emotional side. Knowledge reduces fear. That's the mantra, right, Dawn?
Amen.
So Dawn is going to help give us, you and me, the words and tips so that you feel more in control of your AMD, your condition, when you're at your appointment in your doctor's office. Today's podcast, I could say it this way, today's webcast rather, is about giving you ideas, helpful tips, guidance, and tangible things you can walk away with to leave your when you go to your retina appointments with more clarity, confidence, and control. I could have said that a little more coherently, but you get the idea.
No, it's a great team, David.
This
we
is
need
about
people to understand what we're trying to accomplish today.
That's exactly it. So a few more words and then we'll get started. My team at Audivita, we've worked with Dawn for many years. She is the director, the executive director and founder of the Support Site Foundation. So as I've mentioned, we're thrilled to have her here. Let me tell you more about Dawn. She is a nonprofit executive and fundraiser with leadership experience in healthcare, senior living, vision research, and youth services. She's held senior roles with the Macular Vision Research Foundation, Wesley Enhanced Living, Einstein Jefferson Healthcare System, AtlantiCare Health System, and Big Brothers Big Sisters of America. And as executive director and founder of the Support Site Foundation and the creator of My MACD Life podcast, which is what we worked on with her for all these years, Dawn advances education, awareness, research funding, and access to resources like what we're doing today for all of those joining us and not joining us who are affected by macular degeneration. And Dawn, you are recognized for your ability to build and forge partnerships, strengthen philanthropic support, and guide mission-driven organizations like your own, TSSF. So welcome, Dawn, to the webcast.
Thank you. Thank you. Thank you, David. That's a lot, but
there's a lot there. So take a pause for the cause.
That's right.
So it's my job now to set up the content part of our segment today. The number one, must ask questions that get answers. What are the
we're going to do first? We're going to do must ask questions.
Yeah, number one is must ask questions that get answers. Exactly.
Good.
So, all right. Number two is the confidence to engage about treatment injections without fear. Recognize common challenges that you all share. Rushed appointments. This is a thing. The fear of injections, another thing we want to talk about and unpack for you.
Everything's an injection. That's right.
And then there's transportation. There's stress. Caregivers, care partners, we want to help. And so we're going to talk about that and unpack that. Number three is new ideas on effective ways to slow down the visit. This is, it's amped up. There's adrenaline flowing, right, Dawn? And I've learned a lot from you about this experience of going to a doctor. I mean, I know what it is to get nervous. When they take my blood pressure, it goes up always. And, and the nurse technician will say, oh yeah, you're probably a little nervous about being at the doctor.
We've all been there. We've all been there, right? Yeah.
That's right. So here we understand, I mean, you're about to get an injection or maybe not, but it's an intense experience. So we want to help give you some tools to help you slow the experience down, put it in slow motion so that you can relax a little bit and focus on the questions and what you need to know, building a meaningful relationship with your doctor to the extent possible. And then finally, number four, tips for caregivers to advocate without interfering and adding stress. So your caregiver may be there with you, and we're going to help kind of forge that partnership you have with them and your doctor. So
there you go. Those are the four. Those are the four we're going to cover today. That's perfect. And I hope everyone, the audience listening, kind of has that framework now. You know who we are. You know what we're going to do. We're with you for the next 30 minutes or whatever. And those are the four things we're going to try to, topics we're going to cover as best we can. Yeah.
Brilliant, Dawn. So it's my job now to toss it to you for a little bit of knowledge capital and unpack some of these things.
There you go. Well, thank you for tossing it over, David. Again, warm welcome to everyone joining us. I'm going to click my notes over here. Let's dig into the first, number one, right, David? The must ask questions. Let me just tee that up by saying this. Keep in mind, because I'm a big fan of managing expectations, including folks who are on this call or this webcast. So we want to get a better sense of our audience here and kind of where you're at, as you said, on this low vision journey. And again, this is in the clinical setting, okay? And so I think we want to give you answers that are clear or suggestions for questions, I should say, which are our answers on what you should ask your retina doc. So it's a little tricky. But I think once we get into these must ask questions, we need to take a little poll of our audience, right?
Absolutely. We will have those polls going.
Let's do your ding.
All right. Yeah, when you hear this sound.
We have some questions first.
Is that loud enough? Once more. There it is, a little better. And that'll signal the first poll question when that comes up. And by the way, speaking of questions, there is a Q&A feature on this webcast, and you can chime in and ask anything you like. and we'll do our best to field
This
it.
will be a
Dawn,
deep
the expert,
dive.
will do her best to field it. I'll be watching for questions
That's right.
as they
It's
come
okay.
in. So here's your first poll question. This is sort of to set the stage, and that is, do you have AMD?
Okay, people
And,
are answering.
and then we have options. You can see what the
Okay,
options are. I can read them now. I have wet AMD. I have dry AMD. I have both wet and dry AMD. I don't have AMD. I'm a caregiver, loved one, or just here to learn more about AMD. So
okay, great. So let's get those results in. I see a little on the poll question that I'm viewing. We're interested in question number one. Do you have AMD? All right. So hopefully that little ding, that audio cue has gotten people to get in front of their computers and answer.
we have, yeah,
So
we have a lot of
most
results
people
coming
have
in.
wet AM. A lot of people, folks are still answering, but most people
Yeah,
have
yeah.
42% looks like
Yep,
45%
yep.
have wet MACD, as I like to
Hmm.
call it.
Hmm.
Um, a lot of people, about 20% have both, which is very common. You can
Yeah.
have both, folks. You can have, and I'll talk about this second. Some have dry only. And then, oh, good, we've got a great group of caregivers here who are just want to
Oh,
learn
yeah.
more.
Thank you
So,
guys
all
for
right,
really
good. They
jumping
don't
in
have
here.
it
Yeah,
yet. They don't,
this is
right.
good.
Okay,
All
good.
right, all right.
So we can end the poll here. Um, and let's dive into that. So, in terms of must ask questions, the must a must I got to get rid of my little thing in front of me. There we go.
Yeah.
A must ask question then, folks, is exactly what we just asked you. Ask your retina doc if you do not know. Now, those of you that answered the question, obviously you know what you have. But it does change. So it's very important. Be amazed at how many people, when I travel all over the
Mm,
country and talk to folks, they're not sure what they have. So
wow.
the must ask question is, do I have dry macular degeneration? Do I have wet? Doc, this is to your doctor.
Yeah.
Okay. Do I have both? What eye do I have the wet in? What eye do I have the dry in? So ask, which eye
Wow.
is it?
So you can
Right or left?
have combinations of right and left?
Absolutely. You can
Right,
have
right.
your left could be dry and your right could be wet. And okay, so make sure that's a good point. Make sure that a question that you ask, a must ask, is what is going on with my AMD? What do I have in my right eye? What do I have in my left? And what do I have in both? Okay. Okay, that's very important. And for some of you, we're going to ask another question soon. But for some of you, if this is you've just recently diagnosed and you're not sure about that, or if you are a caregiver or care partner and you're not certain what the answers to those questions are with the patient or the loved one that you're in the exam room with, or that you've accompanied, as maybe the transportation or what have you, make sure that you ask. Okay. That's
Yeah,
really important,
yeah,
right?
yeah.
And it does change. So that's a very critical must ask question. Okay.
Okay, thank you.
How the second one is that relates to the diagnosis of do I have dry, wet, etc.,
Hmm.
or both, is how, what does it mean? Again, these are directed at your doctor. What does it mean? What is the difference between wet AMD and dry?
I was going to ask, and I'm so glad
That's
you went there.
correct. And here's why, folks. You might say to me, well, like my doctor might not want to go into all that. They can answer that briefly. They can answer that effectively. And again, keep in mind, we have disclaimers at the end of this. I'm not a medical doctor, or a researcher, but I'm everything else. Okay.
That's right.
And I am a caregiver myself. I'm a care partner. I've taken hundreds of people. I've been in those clinical settings and I've witnessed it. So there's the empathy and understanding that we are bringing this to you with.
Yeah,
Okay.
yeah.
I do know firsthand and have had years of experience with it. So I don't know that I need to underscore my credibility, but I want people to understand it's not a stupid question. Okay. And it does change. So if you ask your retina doctor every time you see them, there's nothing wrong with that. Trust me, they're not going to remember that you asked it last time.
Very true. Facing thousands of people
Okay,
and
right.
patients is
Because
part of it.
keep in mind the average retina appointment,
Yeah.
6 minutes with the doctor. And we're not going to get into waiting times in the waiting room, but because everyone on this webcast understands that it's
Yeah.
intense.
Yeah.
There's oftentimes a backlog, etc. So that brings in the rushed part. So when we say must ask questions, have those ready. Whatever our tip for you is whatever's easiest for you, whether you have them written down in advance so you don't
Hmm.
forget, because
Hmm.
David, you referred to how stressful this is.
Yep.
Even the ride over is stressful because
Yep.
you know that you're going to have to wait. You know what's ahead of you. You know if you're getting injections, because there are injections, and we're going to move to that in a second, for
Yeah.
dry and wet now. That's the beauty of it. But everything's the delivery system for the treatments is injection only.
Wow.
So, and that's not fun. And we know that. And for those of you who've been getting them for years, or for those of you that haven't started yet, or for those of you that have just gone through maybe a 3 month drill,
Yeah.
kind of, it's have your questions written out. Okay, so those are the two questions that are key. The other one that is a must ask, and then we'll move on to the next set of poll questions,
Okay.
is am I going to go blind and lose my vision completely?
Wow.
I encourage people to ask your doctor that. And here's why.
Mm.
Because you need to know the answer from them. It's peace of mind. I can tell you the answer is no, you are not going to go completely blind. I can tell you that. I can tell everyone without a doubt, there's no one out there that's going to go completely blind.
So that is the fact.
That is the fact, but I encourage as a patient advocate, because
Yes.
the Support Site Foundation is your advocate.
Yeah.
Okay. I encourage everyone to ask your retina doctor that question because that's the basis of the exam. You need to know their answer.
Mm.
Okay.
Powerful.
So I'll leave it at that. We'll keep moving
That's
on. We
good.
gotta
That's
watch
good.
time here. I get it.
Yeah, no, it's good. There's so much to unpack, and folks can
Yep,
always reach you outside of this session.
absolutely.
This is to let folks know how we can be helpful, how you can be helpful with the
That's
foundation.
right.
All right. Are we ready
So
for number two? Are we
yeah,
ready?
no, the second
All right.
tab,
So we have second. These are
confidence about injections.
this
Good.
is poll question number two, Sean, and here they come.
Okay.
So the question, I'll read it out loud. Are you currently receiving injections? So here's where we get into this. And
Oh, okay. Good.
we still have answers coming in.
Yes
It's
and no.
fairly even, yes and no, but we'll wait until everyone's chimed
Good,
in,
because this
and then
again,
you can
folks, the
address it.
reason,
Yeah.
yep, sorry to interrupt you,
No,
David.
that's fine. It's fine.
Talk over you, I mean.
That's fine.
The
We're good.
reason that this is really critical, this part is, as David said, in the clinical setting, it really is the number one,
Yeah.
concern. And this
Yeah.
is how you get, it's not like you're going home and you're taking pills. It's not like you're driving, for your blood pressure, as you mentioned before, or your diet, what, if
Yeah.
you have other chronic diseases like, diabetes or asthma. It's not like you're going to the pharmacy and picking up your prescription and then continue to take your treatment. The injections are the only thing. This is where you get treated in the doctor's office with an injection. So that's why I can't emphasize enough, folks, that you've got that opportunity to be with the retina, the vision tech or the retina doc. That's your opportunity to ask questions and to be engaged and to advocate for yourself. And also, if you're a caregiver, to be there in support of the patient, of the person that you're in the exam room with. Okay, so this is your window of opportunity. And I'm going to sound like I don't like retina doctors, and that is not true. They are, we couldn't live without them, right? They might know that, but but this is your opportunity to get their attention because you're receiving your clinical treatment. Now, I do understand and we know that your doctor will come in and out. It may or may not be your doctor who gives you the injection. Now in 2025, the majority of injections are not, the procedure is not performed by the physician. It's performed by somebody else on the staff. So these are questions to ask your retina doctor, but if the staff involved are also knowledgeable. Okay, I just want to preface that. Okay,
Yeah,
so the poll thing. Okay,
exactly what you're asking, but it does look
hi
like folks
Mary.
are jumping ahead a little bit, so that's okay. I mean, we'll just take them one at a time here, I think, Dawn,
Yeah, let's not
and
let this
because
fall just
subject matter, you have to take them one at a time anyway, just naturally. But we'll have some results on all of them as they come in.
So
So
currently receiving injections, the
yeah,
majority
so
of
we have
people.
56 versus 44. 56 yes, 44% no.
Okay,
So
and the
you
subset
understand
of
the
that.
audience. Yeah.
Yep.
Yeah, so you know the audience a little bit better in terms of who is um
So for those that are 0 to 3, we've got a pretty big clump of 6 months. So no, there are a few folks that are not appropriate. No, it's not them, so they're not their caregivers or partners and care partners.
yeah, yeah,
Okay, so what do you say, David? What's the math? Check me on this. 80% of people who are receiving injections,
yeah.
right, in this poll
Hmm.
are 6 months or longer, 3 to 5 months, 0 to 3.
Yeah, I mean it's 40% of this question. So
Okay, good.
yeah, I think if you do that math. Right.
So,
So yeah,
so let me dive into that.
perfect.
Okay. Uh, so we talked about the fear. Okay. We talk about, so this poll shows us that those frequency numbers, folks, 0 to 3 months, 3 to 5, 6 months or longer, are really important in terms of how it relates to the questions you ask your retina doctor.
Mm,
Okay. So if you have not asked many questions, now's the time to start.
yeah,
Whether you're 0 to 3 months, you're 3 to 5, or you're 6 months or longer, now's the time to start. That is a universal message, and our hope for today is that we are empowering you and giving you some of the tips and ideas and tools that you need. Correct, David? So let's respond to those numbers.
okay.
So many of the new treatments on the market today, and just as a disclaimer, I can't comment on specific drugs during this webcast
Right, right.
that are out there and available on brand name drugs, but I can comment in general. And for those of you who want to have one-on-one conversations or ask more, I will make myself available.
Perfect. Yeah,
Um,
yeah.
but I want to say, so 0 to 3, the new drugs on the market, okay, you have to get leveled up,
Oh.
okay? They require, right, that you
Mm-hmm.
get frequent shots because you're building it up with the treatment. You're
Interesting.
building up your stockpile,
So you
basically.
might say it's front loaded in terms of the treatment. And then does it
Exactly.
level out? Does it start to level out
Well, no,
after?
not necessarily,
Not
but you have
necessarily?
to
Okay.
you have to build up. You have to drink a lot of water to,
Right,
you gotta
right.
do, okay, in a very short amount of time.
Okay.
And then depending on then your treatments will start to be less frequent. Once the doctor in the clinical setting, again, giving you the confidence to understand this. Now,
Right.
here's a must ask question, folks. If you are in that 0 to 3 month phase where you're getting injections, and there are multiple drugs for dry and wet that are
Yeah.
involved in that,
Yeah.
okay? Now, this is the advancements in the science, and quite frankly, the Support Site Foundation has had a significant impact on
Mm,
getting us here, I will have to
mm.
say, to toot our research horn. But if you are in that stage, a must-ask question is why why is this important that that I have to do this? What benefit? How do I benefit?
Mm-hmm.
Okay.
Mm-hmm.
Why do you require me to come this often and get injections?
Right.
And by that time, when you ask that question, you should know if you don't know the drug they're giving you. I'll just mention one, Eylea. If you don't HD, if Syfovre, if you don't know the drug they're giving you, that's the time to ask it. And if you are a caregiver or a care partner in the exam room, please retain that information.
Mm.
Okay, because it's really important for you to understand why the heck you have to come so often.
Yep.
And is this going to level off, as you said? Is
Yeah.
the frequency going to change?
Yeah.
And please, folks, I'm just going to say it. Those of you who know me personally know I'm very direct. Don't get a piece of paper. Don't just take a piece of paper, a handout that explains it. Sure, fine, tuck that in your pocketbook, whatever, but ask the doctor.
Yes.
There's one question that if you're in your second month of the 3 months, if there's one question you need to ask them, you haven't asked them yet, take the time to make them answer you.
Yes. And this points telegraphing a little bit question number 4 for today, which has to do with the relationship, the quality of the relationship you have with your retina
So
doctor.
let's talk about that.
Yeah.
Let's talk
So
about
if
that.
you like, I can ring the bell
Go for
and
it.
we can move into that.
So we're
And
segueing to, again, this is a little bit, we're giving you must ask questions as we go along, but we're also helping to build that confidence with the treatments, injections, right? And
yeah.
this is part of that.
Yeah. Now, a few of you have already answered number 4, but I'm going to ring the official bell now for poll question number 4. We'll take a breath here. And some of you had already chimed in before we got here. I'll read the questions while we're waiting. How would you describe your relationship with your retina doctor?
What are the
Option
choices,
one is
David?
the choices are one, I don't have time to ask any questions. So that's the sense you have. This is pointing to slowing down the appointment because that's a distress point, right? It's option two, it's okay, but I don't understand what he or she is saying. Okay. So there's
Delay
comprehending
terms.
what's going on here. Number three is when I ask a question, I don't feel like I'm heard. So it's
Mhm.
you have a sense that they're not connecting with you. And finally, I rely mostly on others, your care partner, your caregiver, to communicate with the doctor. So those are the 4 options. So please chime in on number 4. We really want to, because a lot of this is, there's an emotional component to being in the room with a doctor. And we all have this, whether it's a retina doctor or any doctor. The quality of that relationship is so profoundly important. Do you feel
Absolutely.
confident, feeling empowered, feeling like there's some sense of control in a world where we don't have as much control as we want?
And you're
Um,
seeing them a lot, maybe. I mean,
yeah,
and you are one in a gazillion people that they see. So having a relationship with them is really important.
yeah, they are people. It's a 360
Vision, it's
degree
precious.
relationship. I had said to Dawn when we were prepping for the session, I said, it's sometimes interesting to ask the doctor when they come in the room, how are you? Ask them how
Well,
they
let's
are.
talk about that. What are the results of
Recognize
the
them as a
poll?
human, right? Yeah.
What are the results of the poll? Because I want to go back to that, David.
I see 33% have said I rely mostly on my care partner to
Okay,
communicate. So there is that,
let's slow it
but we
down a
don't
little bit,
but we
David.
don't
Let's
have a
slow it
lot
down.
of responses, and only 30% of the audience with us today has actually answered the questions.
So here's what I want to say about David. Let's go back to patients have a right to be heard and slowing down
Yeah,
the appointment.
yeah, slowing
Okay.
things down, absolutely.
Okay. So, and slowing down the appointment is really important. Let me go back to this. Here's our advice. Here's what we advocate for and what we tell folks. And one of the takeaways I hope you will have at the end of this. And
Hmm.
when you get to your next appointment, maybe it's
Hmm.
tomorrow, maybe it's later today,
Hmm.
maybe it's in 3 months or 6 months. But please pack this away. Okay. If you have not asked yourself what your relationship was with your retina doctor, ask yourself that.
Yeah,
So,
yeah,
this is vision loss is incredibly personal. And the relationship with the doctor, you may or may not have a choice depending on where you live, et cetera, access to care, those kinds of things. We're not advocating to fire your retina doctor here or anything, or call them up at night. We're have dinner with them, right? But
Right.
what,
We're not crossing into that zone, but you want
right.
a quotient of humanity in the room.
Right. So ask yourself that, because if you have not, the answer that you give yourself is really important. Okay. Those are the poll answers that we gave you. So maybe, maybe you feel rushed. So here's something that I think is really important. In the late 60s, a guy by the name of Dr. Martin Seligman coined learned helplessness.
Hmm.
Okay. And you know what that means? We all experience it. It's a state that occurs, and I'm going to read this, a state that occurs after a person has experienced a stressful situation repeatedly. They come to believe that they are unable to control or change the situation, so they do not even do not try even when opportunities for change become available. Let that sink in for a second, please, folks. So, depending on the answer that you gave yourself as to what your relationship was with your retina doc, okay? And when you get in the clinical setting, that's when you have the relationship. That's when the rubber hits the road, right?
Hmm.
So, you this webcast is an opportunity to give you some change. We're making it available for you. So if you feel like you are completely informed by them, they have told you everything that you possibly could want to know. Good,
Yep.
that's fantastic. But I still recommend asking them a question
Hmm.
each time you see them.
Oh,
Whether
that's
it
good.
is, how are
Yep.
you today? Okay. And when you ask your retina doc, when they come flying in the exam room, oh, hello, Mr. Wolf, how are you? Ask them how they are, because guess what, folks? That is how to slow down the appointment.
Right. That's right. That's one technique. It opens up a conversation rather than just a routine set of procedures that they're so used to. It's like an assembly line. We
Right.
want to personalize the experience for you and slow it down, all of those
And
things.
right. And it gives you a chance to say, oh, I'm great. I'm really rushed, Mr. Smith. Okay, you're rushed. Well, then let me ask my question immediately.
Right. Right. Sure.
Okay, let's just get my question over with before you look at my OCT. Okay,
That's right.
maybe your question is, what does my OCT show? Your OCT is your optical care. It's the top. It's your X-ray, which, by the way,
Yeah.
you helped
Yeah.
fund. Yeah.
Yeah.
It's your X-ray. They may or may not show that to you, but ask. Maybe here's another must-ask question. What does my OCT show? Maybe you have geographic atrophy. Do I have that? There's a question. We have these in a handout, by the way. Do I have GA? If you don't know the answer, because GA is specific to dry AMD, by the way, folks. We have
Okay.
My MACD Life has a podcast all about that. We encourage you to
Yep.
listen to it.
Yep.
But I don't want to get distracted. But the thing is, again, these are ways to slow down and ask yourself, even as you're driving or riding to your appointment, what's my relationship with my retina doc like? How do I feel today? Let
Right.
me ask them how they are.
Yeah. It's like really checking in with yourself, with the
Right.
relationship as an entity,
And right.
and
And
that'll
do
help.
it. Take the
Yeah.
time to do it, because it slows it down. It slows that doctor down. And it gives you the entry point, because I don't, we're all different personalities. Some of us are bold, some of us are direct, some of us whine all the time, some of us complain all the time, some of us don't say one word. Well, when you advocate for yourself, or if you're the caregiver can ask that. How are you today, doctor? I always also recommend always introduce your caregiver. If they're in the exam, every single time I have sat there
Oh,
with
that's really good. Yeah. Because they're really a partner.
integral,
Integral.
always introduce to the doctor your caregiver. Hello, this is Dawn Prall. She's my niece. Or, she's my friend. Identify their role. Folks, that also slows it down. because there needs to be response time.
Right. It
And
just
it solidifies your
it stretches
relationship.
it out.
That's right.
Dawn, I'll do the ding again. So, folks, hope maybe it'll work, maybe it won't. But question 4, we're starting the poll again, so it's going to
Yeah, we
start.
want
So, if you answered before, if you don't mind coming back in, we just want to understand where you are in terms of the relationship with your doctor, so that Dawn, we have Sean and Dawn, so
yeah,
so Dawn can effectively address your concerns about this issue. So,
right. And when you ask a question and you don't feel heard, I'm just while I'm filling in here while people are answering, and I don't. So here we go. If you're asking a question and you don't feel heard, ask it again. It's okay. It is okay to ask a question of your retina doctor. Retina doctors are high on the food chain of the eye doctors. They're high on the food chain of medical providers. They're incredibly smart, incredibly capable people by
mm,
and large, whether
mm,
they're young or old or in between. And they are human beings. They put their pants on one leg at a time. Okay. And if you have trouble hearing, or again, your care partner, your caregiver, we're using that interchangeably because it's a kind of a vernacular that's shifting in the outside world these days.
yeah, yeah.
But if you feel like the patient that you're there, advocating for has not been heard, maybe the doctor just either they ignored it or they didn't hear it or they were just in their own heads because they're human beings too. You can say, doctor, David just asked, how are you today? Or, you can couch it in a way. You can repeat the technical question. It's okay. All right.
I'm sort of reading into this a bit, Dawn, and if I'm doing this correctly, the good news is that a lot of our audience, the participants today, about 45 have participated in the question, are feeling like they have a pretty healthy partnership with their
Okay,
doctor,
good.
which is a
Good.
wonderful thing. Or they're relying on their wife or their care partner or their
That's good.
caregiver
That's good.
to
It's not a,
communicate as a liaison. So we're actually getting some positive results. It's
that's
not
good.
quite as look, we're just trying to help, of course, with all of this, but
That
that's
needs a
good.
village. Takes
That's
a
good
village.
news. That's good
That's right.
news.
Takes a village. So let me comment on something else too, because speaking
Sure.
of that, and then we can move on to close out here.
Sounds good.
Um, you know, there is a sense it's as good as it gets. And when you have MACD and you've been going to the doctor, whether it's every month for 3 months and you're just ramping up and leveling up, or
Yeah.
and then you don't know what's in front of you after that. You don't know if this injection's even going to help you, and maybe you have wet and you already went through prior to that, and you already went through 5 years of injections every 6 months and etc. Whatever.
Yeah.
Everybody's formula is different, but one thing that everyone on this webcast and everyone who suffers from macular degeneration knows is that it's never ending.
Yeah.
Okay, and your hope is that you will end one day, not because you're not of this earth, maybe not, but because we found a treatment and a cure where you could just pop a pill.
Mm,
Or there's
mm.
just a delivery system where you just go to your pharmacy or you have it, shipped or whatever.
Wow.
That day will come, folks. It will.
Yes.
We really do believe that. But until then, just know that in terms of as good as it gets, that's what I'm talking about. This is not as good as it gets. Okay. It's getting better. I just spent a lot of time overseas. I spend a lot of time talking with researchers and clinical professionals and doctors who are also researchers, MD, PhDs, and the universal feeling is patients are asking a lot more questions than they used to 20 years ago, which I say that's because we're doing our job, like
Right.
this webcast. But also, there's so much more out there in the science to delay the time between these nasty injections,
Yeah.
delay the stress, to
Right.
increase the to increase the efficacy of the impact.
Yes.
Okay. So I
Yeah.
just want to give that message of hope.
That's the bridge to the cure, right?
That's
That's
right.
the
That's
the
right.
relief of those things.
So I hope this is helping everyone. I mean, I know we have to move on. We could talk about
Yeah.
this forever. We're going to do other ones.
Sure, absolutely. I mean,
Um,
I was gonna just kind of recap real quick. So here's what we talked about today. And
the
again,
four
if you
points,
want
the
to
four
reach out
points.
one-on-one with Dawn, she's available to do it anytime. This is what you
We have a
do.
handout. We have a
And
handout.
I'll speak about you in the third person, is so dedicated and so caring about the work she does around macular degeneration. There's nobody on the planet. I can't imagine anyone caring as much or more than she does. So this is my experience working with Dawn. Anyway, number one, must ask questions to get real answers. Number two, approach treatment injection discussions with confidence,
That's
not
right.
fear. Number
Ask.
three, right? Number three, let me know if you want to chime in. Uh, Number three, slow down the visit to make sure you're being heard and you're getting the
We
most out of the
gave those
appointments.
tips, right?
That's right. That's right. Number four, caregivers, care partners can advocate effectively without creating stress. In fact, they're there to relieve stress. They'll help you remember the things that you glazed over when the doctor answered the
Right,
question.
take
All
notes,
of that.
introduce yourself.
Yeah.
Ask the doctor to repeat the answer to the question. Even if everybody in the room
Yeah.
heard it, it's
Yep.
okay. Make your
Yeah.
presence known.
Yep.
You're not invisible as an advocate. You're
Ooh.
critical. And doctors need to understand in a clinical setting because MACD, you don't just show up alone. You don't.
That's right. You're never alone, by the way. One of the quotes from Dawn, the more you know about AMD, the less scary it gets, the more confident you become. I added that part. And with the Support Side Foundation, you're never alone. So Dawn and her team are here to help you. It's a family. And with that, I also want to remind folks that we're entering into the last quarter.
Yeah, the PowerPoint, if Hetty can bring that up.
Oh, yeah, that'd be great, Hetty, if you can bring that up.
No,
I never call him Hetty.
not PowerPoint, but or Sean.
There we go. Yeah. We're entering into the last quarter of the year, and that means it's giving season. And so because the Support Site Foundation offers so much valuable, reliable, trusted information like today that you can use, and makes a difference in people's lives 360, 24/7. We want to ask you to consider making a tax-deductible donation for this year, for 2025. Just add the foundation to the top charities you give to, you value and you trust, Dawn and her team. And, we can't do the work. She and her team cannot do the work on research without your help and the support of people like you. So please add the Support Foundation to your will and
do what you can.
And there we are. Do everything you can. We are from Audivita Gives here doing what we can as well to support the work that they're doing over at Support Site. So
thank you for that, David. David, you cannot
welcome.
make that pitch to folks unless you're doing it yourself and your team. So it loses its authenticity. So we want to thank you here at the foundation for Audivita Gives and for all you do and your team. Thank you so much. Let's stay connected. You see the slides. Stay connected with us. We're family. And engage with us. And we can't ask for more because that is the name of the game, folks.
Yeah.
In this big, humongous world we live in, connecting with you with these webcasts is really the most powerful way we can do this.
And Dawn, there's follow-up as well. There'll be
Survey.
materials
Yep.
going out. There'll be a survey. The recording of this webcast is going to be available.
That's right. And that's coming out immediately. We've got that locked
Brilliant.
and loaded, ready to roll.
Brilliant.
Do we have questions from the audience that we have time?
There were some specific questions that
Hetty
came
can
in,
kick off
which we can't really take in the webcast because they related to the results given a particular medication. That was from Charles. Thank you for that, Charles. You can reach out to Dawn if you want to talk
I'll
about
get
that a little
back
bit
to
and
you.
unpack that a little bit.
Yeah.
Yeah, by email or otherwise. So there it is. Folks, thanks so much for joining us today. Dawn, you're brilliant. Thank you for the work you do at Support Site, and we'll continue.
Thank you, folks, for joining us. Have a blessed day. Happy holidays are coming up. Tis the season, as David mentioned, and also for those of you the Jewish faith, Happy New Year. And let's just keep doing this together.
Be well.